That's incredible. And I mean, what a way to honor her. And, as you said, she's left a legacy, and, that will never be taken away. Andy, I wanted to mention, I know, we'd spoken previously at great length about the work you're doing for the indigenous communities there in Canada, and something we're very passionate about. I shared my grandmother was French Canadian Indian. And I know you're part of, I apologize if I pronounce it incorrectly. You're a proud member of the Muskeg Lake Cree Nation. Is that pronounced
Yeah,
correctly?
Los Lake Cree Nation. Yeah.
Got it right. Perfect. And I know you've spoken before, like I said, about the unique challenges the indigenous communities face when it comes to dementia care specifically. Can you kind of help us unpack that and what those circumstances look like in Canada today?
Yeah. So we know that dementia care itself across Canada is bad. It's supposed to be getting a whole lot worse. Across Canada, we're expected to see a 200 and some percent increase across Canada between now and 2050.
Mm.
Really, really not good. But where it gets even worse is in the First Nation community. So just a little bit of a contextual lesson for some of your audience if they're not aware. So in Canada, we have three protected groups that are classified as Indigenous under federal legislation. We've got First Nations, so individuals that have signed a treaty with the with the Commonwealth and the Crown. You have Métis, so generally individuals who have signed scripts, and then you have Inuit, and generally Inuit tend to have what's called like a modern day treaty, whereas a lot of the treaties, like Muskeg Lake and Treaty 6 was 1886, I believe it was like July to September 1886 that it was signed. So these things have been around for a long, long time. We have kind of these three protected groups that are under the Indigenous banner, and we see that the health determinants generally are a little different depending on the type, but we don't necessarily have the data to distinguish between does First Nations versus Métis, does Inuit have different dementia determinants. We don't know it to that minute level. So a lot of the time, as I'm going to talk about Indigenous, it's kind of talk about Indigenous as a whole with those three protected groups. So in 2006, less than 5% of the Indigenous population across Canada was over the age of 65.
Mm.
So less than 5% of Indigenous people across Canada were our elders. And in Indigenous community, elders are so important. They carry on the knowledge, they pass on knowledge, they say what's good. They are the guidance mechanism for the community. Right? Before a big major decision gets made, elders are brought in to talk about it because they have the wisdom to make these decisions. But the crazy thing is that in 2006, less than 5% of our Indigenous population was that. By 2016, this rose to 7.3%. And by 2036, they're estimating that this is going to be over 15%. So this is really, really good. We're seeing Indigenous population is increasing. We're seeing that some of the health determinants are getting a little bit better, but there's still tons of problems, right? If we want to have a safe and secure and healthy Indigenous population, we need to make sure that our seniors and our elders are aging appropriately and we're taking care of them across the entire spectrum. So in Alberta specifically, dementia rates are 34% higher than within First Nation communities. So we see 34% more prevalence for dementia for First Nation folks than across Alberta. And interestingly, we see men are also more prevalent to have dementia in Indigenous communities than women, which is kind of against statistics everywhere else. Why? I have no idea, but it's an interesting statistic, right?
Right.
And Dr. Jennifer Walker and Dr. Lynn Croshaw argue that some of the colonial implications, whether it's residential school, 60 swoop, whether the negative impact of anti-Indigenous bias in healthcare, whether it's the resident or the reservation system that Indigenous people were forced to live in, maybe whether it's disenfranchisement, all these things lead to intergenerational trauma, which is uh, likely a large contributing factor to those dementia diagnoses. Dr. Pamela Roach, who is an amazing medical researcher here in Alberta, she did some research in 2023 and found between 10 to 25% of practicing Alberta physicians have reported explicit anti-Indigenous bias.
Mm.
And that overall, across Alberta, Alberta physicians have a moderate implicit anti-Indigenous bias. That's pretty wild.
Yeah.